Dr. Kara Chris there, just sending us this video reminding Arizonans to stay vigilant heading into the holiday season, like, of course, wearing masks, social distancing and holidays, and holding your events for the holidays, holding them outside. On the heels of Thanksgiving holiday, the CDC asked Americans to stay home, and now they're doing it again for Christmas, no holiday travel. They hope this time people have enough warning to cancel their plans so we don't see another holiday surge like we're seeing now. Dr. Paul Lynch from Arizona Pain joins us live. Thanks for being here.
Hey, thanks a lot for having me tonight.
And talking about that CDC warning, the CDC sent out that warning very close to the Thanksgiving holiday, the first time people may not have had enough time to cancel their plans. Now they do, because the warning is coming out now for Christmas. Perhaps it is dire that people heed this warning this time around.
Yeah, for sure. I mean, we're in the midst of the worst days of coronavirus, and I've done a lot of teaching on this year, and we are close to the end. I mean, I've told everyone that'll listen, give us a few more months to roll out these amazing vaccines that we have with 95% efficacy. But the next 3 or 4 months, we have to do everything we can to stop the spread, and that means that Christmas is going to be a little different this year, unfortunately.
We're going to talk about those vaccines in just a bit, but let's talk about traveling. You know, people may be very literal about this. Okay, I won't get on a plane, but there may be some college kids who are driving in, coming home from NAU, Arizona. Your advice to folks handling that, how do you handle that?
You know, it's hard. We're talking about a completely untenable situation and how we make the best of a bad situation. According to the CDC definition, your children that are away at college, that's a different household because they're going to be bringing germs into your home that weren't there before. Now, I mean, I don't know what that means practically. We tell our kids they can't come home. They may not have a place to stay over the holidays. I will just tell you that when they come into your house, they're going to increase your risk. And so I think each person needs to gauge it based on their own risk. You know, the safest thing we could all do is 0 human contact, but of course that's not possible. And so we need to balance the risk based on your own risk level. I'll use my mom as an example. She's 70 and she's been pretty much quarantined this year, trying to make sure that she makes it through this alive. But it was her birthday a couple weeks ago and we wanted to see her, and we went to her house, but we stayed outside. It wasn't even 6 feet away. We stayed 10 feet away and we wore masks and we were able to celebrate her, but I don't think we increased her risk really at all. And so I think as you think about your kids coming home, depending on your risk level, you need to make efforts to distance yourself.
Yeah, that's going to be rough for folks who haven't seen their kids in quite some time, but it's good advice. So back to those vaccines, we know that they are on the way, and we know by now the order in which people are going to be able to get these shots. So when would you think that everybody, not just the healthcare workers and the order in which you're going to give the shots, but everybody will have the vaccine? When will that be?
It's amazing. I actually read about it the last 2 weeks. I did a video on this today to try to educate some people on social media. And it looks like healthcare workers and people that are living in long-term facilities, that's about 24 million people total. They're going to get it first, and we could have that done by the end of this year potentially, or definitely into the first 2 weeks of January. And then the next group that's going to get it is going to be the elderly and people that have coexisting diseases like diabetes, hypertension, obesity, and heart disease. Starting in January and February, we're going to start being able to vaccinate 60 to 70 million people a month. And the White House says that we should be able to vaccinate everyone in the United States that wants to be vaccinated by around June of next year. That's incredible news for us. And it actually means that most of the people that were going to die from this that were high risk are going to be protected by February or March.
So June, that is summer next year. Everybody should have that vaccine, and hopefully things will be somewhat back to normal by then.
It's incredible. And this isn't like people talk about, oh, the world's never done this before. You know, we have. We save about 3 million children every single year just with our vaccination program around the world. You know, from the smallpox vaccination came out way back in 1796. We've saved about 200 million lives with smallpox. So our use of vaccinations has been part of our healthcare system for over 200 years. This vaccination, or this vaccine that we have, is safe, and it's going to save lives. And we all need to get excited about it as soon as we can, because that's our chance of going and watching football games next fall.
Great information. Thank you for your insight. Dr. Paul Lynch, you're awesome, from Arizona Pain.
Thank you.
Thank you. Be safe.